Well, is there a marriage penalty built into President Obama's health care law? According to some analysts, yes. Critics say the new law discourages marriage by making it easier for Americans to get insurance subsidies if they're single. Well, joining us now to flesh it out and have a fair and balanced debate, Congressman Phil Gingrey, co-chair of the House GOP Doctors Caucus, and Congressman John Garamendi, who's the former California Insurance Commissioner. Gentlemen, welcome to you both.
Thank you, Shannon.
All right, Congressman Garamendi, I'll start with you. I mean, this information comes out today from analysis involving the Joint Committee on Taxation, and CBO says basically you do better if you're single because once you get married and that income adds up, it's less of a chance you're going to qualify for the subsidies. Is there a so-called marriage penalty in this health care law?
Not really. Actually, the law really does provide much better coverage for everybody, both married as well as single. It has to do with the tax credit that is available under the law. And that tax credit is based upon the traditional poverty level that's been in the laws for about 35 years now. If you look at that, if you're married and you have a family, it's presumed that you do not have as much need for a subsidy as a single person unmarried. So that's been around for a long, long time, and using that same formula, it is the way in which the tax credit is allocated. The result of it is that under the law, everybody will have better access to health care and to health insurance, and that's what the goal was.
And Congressman Gingrey, I'm guessing that you would disagree with that position.
Absolutely, Shannon. Only 18% of the population, in fact, thinks that they will be better off under Obamacare. But what John is missing, the point is in this bill that they rushed through, all of a sudden, Nancy Pelosi's right. They had to get it passed before we finally found out what was in it or indeed what is not in it. And there is not a provision to eliminate the marriage tax penalty. Now, the Bush tax cuts of 2003 did that. We have extended that until the end of 2012 in regard to taxation and filing jointly and encouraging people not just to cohabitate for tax reasons, but to actually get married. We believe in the sanctity of marriage. But that was not provided for in Obamacare. And I think when John goes back and reads the bill or has his staff inform him about that, he'll find that that was one other provision, like the lack of severability of clauses in the bill, so that when the Supreme Court strikes down the requirement that individuals purchase health insurance maybe against their will, that domino effect would destroy the entire bill.
Well, and Congressman Garamendi, we now wait to see what the Supreme Court will do with the case, but would you be open to any kind of modification of the current law or regulations that would clear up this issue, this disagreement about whether or not there is a penalty for being married?
Well, of course, if in fact it does exist at all. The congressman, my buddy there, is absolutely correct. It is the current tax law that is used to determine the tax credit available under the Affordable Care Act. Now, always, every bill, and even including the U.S. Constitution, changes over time as circumstances change. So if there is a problem, many of us think that the bigger problem is the fact that millions of people have lost their insurance as a result of the unemployment. And we want to get people back to work. And if they go back to work, the chances of them getting insurance from their employer is pretty good. Not as good as it needs to be. But this Affordable Care Act is going to be before the Supreme Court. It's quite possible the entire thing is thrown out, and then we're going to have to start all over again. But the underlying problem is you're still looking at millions of Americans without insurance. The Affordable Care Act does allow about 1 million children actually young adults aged 21 to 26 to continue on their parents' insurance. And I got to tell you, that's really important. One of my daughters fits into that category. She was uninsured for about 1.5 years. The new law kicked in. She's now back on my insurance, having insurance coverage. Also, the new law provides for seniors to get medical services and wellness care and preventative care. And also the donut hole, that infamous drug donut hole, is being closed with over 1 million seniors getting additional help to purchase their necessary drug benefits.
Okay.
So there's a lot of things that are good in the law. We'll see what happens. It will be before the Supreme Court. This issue is going to remain before the American public for a long, long time. as we see the continued escalation in the health care costs across the nation.
All right, let me bring in.
Yes, I'd love to engage in a debate with my good friend.
Okay, let me bring in Congressman Gingrey. We're just about out of time, but to be fair here, to give you a second chance to answer, close us out.
Well, Shannon, I think it's a misnomer to call it the Affordable Care Act. It's the Unaffordable Care Act. And there's so many mistakes in the bill, and John essentially has admitted that. And yeah, we could go back and make some changes, but I think the only way to really do this, and that's why I voted to repeal all aspects of Obamacare and go back and start over, because this was rushed through. We all know about reconciliation, and Senator Brown from Massachusetts was supposed to be the 41st vote to stop the passage of Obamacare, but they wanted to rush it through. They've shut the door now on the Class Act, the long-term care provision, which is totally unsustainable. Thank goodness Secretary Sebelius finally admitted that.
And we will wait to see if the Supreme Court tackles this and decides the debate, at least at that level, once and for all. Gentlemen, thank you both for your time.
Thank you,
Shannon.
Well, under the Freedom of Information